picture this.
Yeah.
You're out in rural India. It's humid, maybe that post-monsoon feeling.
Yeah.
You're near the fields, could be working, could just be walking. Everything's green, buzzing.
Yeah, very live.
And then boom, sharp pain. Maybe you see scales, maybe nothing. Just the bite and pure terror hits.
It's a horrible image. And for so many people in India, it's not just an image, it's terrifyingly real every year.
Exactly. This isn't some rare accident. It's a massive crisis. India is, tragically, known as the world's snakebite capital.
It's a truly awful title to hold. And the numbers, they're almost hard to process at first. We're talking about something like 58,000 deaths every single year, just in India.
58,000, wow, annually.
Annually. And put that globally, it makes up almost half of all the estimated snakebite deaths worldwide.
Half. So one country
Carries nearly 50% of the global burden.
Yeah, staggering. It's like an entire town wiped out by snake bites year after year. And we saw figures suggesting that during peak season, the monsoon, it can get as bad as one death every 5 minutes.
One death every 5 minutes. That intensity during the monsoon, it's just brutal. And it's exactly why the WHO, the World Health Organization, has classified the snakebite envenoming as a, quote, neglected tropical disease.
Neglected. That word feels wrong somehow. Next to 58,000 deaths a year.
It should feel wrong because this hits the most vulnerable people hardest. You know, the rural poor, indigenous communities, farmers, laborers, people working the land where the snakes live.
People often without easy access to good health care.
Right.
Or maybe less political clout.
Exactly. Less access, less voice, sometimes less information. So that's what we want to dig into today. Go beyond that shocking headline number. Why India? Who's most affected? What are the sometimes surprising hurdles to getting treatment? And importantly, is there hope? Are there ways forward emerging from this?
Right. We've been looking through the different angles on this, and it's definitely complex environment, society, the healthcare system itself.
Yeah.
All tangled together.
Our aim here is to try and untangle some of that, to really focus on the core realities of this tragedy that honestly doesn't get enough attention.
Okay, let's jump in. That number again, 58,000 deaths a year.
Yeah.
You said it's consistent.
Very consistent. Looking at data from 2000 to 2019, it stays right around that mark. That adds up to, well, a horrifying 1.2 million lives lost in just those 2 decades. It's relentless.
1.2 million. And comparing the 58,000 to the global estimates, maybe 81,000 to 138,000 worldwide, India's share is just. It's overwhelming. It could be over half, maybe even closer to 70 or 80%.
It absolutely dominates the global picture, which means, really, that any serious effort to cut down snakebite deaths worldwide has to focus heavily on what happens in India.
Which brings us right back to, why India? What makes it the epicenter?
Well, it's a potent mix. First, just the sheer biodiversity. India has around 310 different snake species.
310? That's a lot of snakes.
It is. Now, not all are venomous, of course. About 66 species are potentially harmful, but most of the deaths, the really serious bites, they come down to a specific group.
The famous Big Four.
Exactly. The Russell's viper, the common krait, the Indian cobra, and the saw-scaled viper. They're the ones causing the vast majority of the problems. And the Russell's viper, in particular, is responsible for a huge chunk, something like 43% of identified cases.
Why that one so much? Is it more aggressive or just more common?
It seems to thrive near humans. Agricultural areas, places where people live and work. They seem to do well there, maybe attracted by rodents, which are also new settlements. So you have this highly venomous snake living cheek by jowl with huge numbers of people.
Okay, so the dangerous snakes are right where the people are. What else adds to the risk?
Population density is huge, 1.4 billion people, and a very large proportion living rurally. So millions are living and working right alongside snake habitats. We saw a stat, 97% of snakebite deaths happen in villages.
97%.
And often the bites aren't just out in the fields, they happen inside homes, especially at night.
Inside? That's terrifying. No safe space even when sleeping.
It's a huge factor, especially with the common krait. It's nocturnal, often bites people sleeping on the floor. And then you layer on the monsoon season. June to September, usually. That's peak danger time.
Right, because the rain floods them out of their usual spots.
Exactly. Burrows flood, low areas get waterlogged, so snakes look for higher, drier ground. And that means human spaces, homes, paths, storage areas. Half of all the deaths in a year happen in just those few monsoon months.
Half the deaths in just 3 or 4 months.
Yeah, and we saw that figure for mid-July potentially hitting nearly 300 fatalities a day. That's where that chilling one death every 5 minutes comes from. It's this perfect storm of human density, snake behavior, and the weather patterns.
Okay, so geography, climate, population, the specific snakes.
Hmm.
It paints a pretty clear picture of why it's such a crisis nationally. But where is it hitting hardest? And who?
Yeah, it's not spread evenly. There are 8 states that account for about 70% of all the deaths.
70% in just 8 states. Which ones are they?
It's Bihar, Jharkhand, Madhya Pradesh, Odisha, Uttar Pradesh, Andhra Pradesh, and Telangana together, Rajasthan, and Gujarat.
And what do they have in common?
Generally, large rural populations, lots of low-altitude farming land, basically economies where many people work outdoors.
And the death tolls within those states are just huge.
They really are. Uttar Pradesh, around 8,700 deaths a year. Andhra Pradesh, about 5,200. Bihar, 4,500. These are the real hot spots within the country.
And the people most at risk. You mentioned farmers and laborers.
Yes, definitely. The data shows they're the primary group. Makes sense, right? They're out in the fields. About 77% of bites are on the legs, typically while working. But it's not just working adults. Kids under 15 are over a quarter of the victims.
A quarter? That's awful.
It is. And adults in their prime working years, 30 to 69, they make up nearly half the deaths. It hits families, communities, right at their core.
We came across some powerful stories that really bring this home. Ratnamma, the farmer in Karnataka, her story was just devastating.
Ratnamma's story. Yeah, it's tragically typical, and it shows so many parts of the problem.
Yeah.
Bitten in the field, her husband did what many do, took her to the local folk healer, an OSHA.
Right, the traditional route first.
Yes. And the healer, after about half an hour, realized it was bad and told them to go to a hospital. But that delay, the time lost, it was critical. She died on the way only 40 minutes after the bite.
40 minutes? That's incredibly fast.
It's just a really massive dose of venom. Her story just starkly shows the danger of relying on traditional methods that can't actually counteract the venom and how critical transport delays are. Getting to proper care fast is everything.
And then there was Satish, the coconut farmer. He survived, but his story showed another side of it, the cost.
Right. Satish lived, but he ended up spending 11 days in what was described as an unlicensed facility in his village, kind of an informal snake hospital.
Unlicensed. That sounds dicey.
It does. And on top of the risk, the bill was $11,000. That's a huge amount for a farmer. It can be crippling debt. His experience shows how common these informal, maybe unsafe options are because licensed care might be too far, too costly, or just not set up for snake bites. And it wasn't unusual in his village, apparently.
These stories just hammer home the human cost behind the statistics. And speaking of stats, that Karnataka example was fascinating, how just changing the reporting revealed so much more.
Yeah, that was striking. In February 2024, Karnataka made snake bites a notifiable disease, meaning every single case, fatal or not, had to be officially reported by all health facilities.
And the numbers just jumped.
Jumped massively. In 2023, before this, they recorded about 6,600 cases and only 19 deaths. In just the first few months of 2024, after the change, it shot up to over 13,000 cases and 101 deaths.
Wow. Just like that, it shows how much was being missed.
Completely lays bare the hidden burden. But even with better data, Karnataka still faces issues. Like they have regional snakes, king cobras, Malabar pit vipers, where the standard Big Four antivenom might not work very well.
Which leads perfectly into the next big piece. The challenges in treatment, the systemic problems, the antivenom itself. You said India makes a lot.
Yeah, production volume isn't the main issue. India is a major producer. But the critical question is it the right antivenom for the specific snake? The standard stuff targets the Big Four, but as we just saw, there are at least a dozen other highly venomous snakes around India. If you get bitten by one of those,
the standard antivenom might not do much good. It's like having a key for the wrong lock.
Precisely. It's a major gap. And even if the right antivenom is available somewhere, getting it to the victim fast enough is absolutely vital.
That golden hour concept.
Generally, getting antivenom within 6 hours gives the best chance, but the reality, a third of victims in rural India don't make it to a hospital in that window.
A third? Why so long?
Remote locations, just sheer distance, lack of transport is a huge one. And, as we saw with Ratnamma, delays because people go to traditional healers first. All eats into that critical time.
So you could have antivenom stock in a clinic, but it's useless if the person can't get there, or if the doctor isn't sure how to use it, or it's the wrong type.
Exactly. Access isn't just about having the vials, it's about getting the patient to the vials and having trained staff use them effectively. And that's another hurdle. We heard from a public health physician that many doctors, especially in smaller rural clinics, just don't have the specific training or confidence to manage snake bites well. It's a specialized skill.
That's a huge weakness in the system. Reaching a clinic isn't a guarantee of getting the right care.
Correct. And then there's the cost. Even if treatment is available, paying for it can be devastating for poor families. It forces that awful choice, potentially crippling debt versus relying on cheaper, ineffective traditional methods.
It seems so overwhelming. Given the numbers, the impact. Why has this been, as the WHO says, neglected for so long?
The strong feeling is that it's seen as a poor person's disease. It mainly hits these marginalized groups, farmers, tribal communities, laborers who often lack a strong political voice.
Less influence to demand attention and resources.
That seems to be a big part of it. One public health specialist pointed out the contrast with something like malaria. Malaria kills far fewer people in India now, but it gets way more focused government tracking, funding, and public health attention. Snake bites just haven't had that same level of sustained focus.
And the bad data didn't help, I imagine, if you don't even know how big the problem truly is.
Absolutely. The underreporting was rampant because often only hospital deaths were counted. We even saw examples where different government agencies had wildly different numbers for snakebite deaths. That kind of confusion makes it easy to downplay or ignore the problem.
Wow. So it's this tangled web of biology, poverty, weak systems, and hidden numbers.
Yeah.
But is it fixable? Are there signs of hope? Paths forward?
Yes, definitely. It's daunting, but there are clear pathways and some important steps are finally being taken. Making snakebites notifiable nationwide in 2024, following Karnataka's lead, is huge. Mandatory reporting is the bedrock for actually understanding the true scale and targeting efforts.
That feels like a game changer, potentially.
Yeah.
Finally getting a real count.
It really is, and there's a national action plan, the NAPSE, aiming to meet that WHO goal. Cut snakebite deaths in half by 2030. Now, having a plan and implementing it effectively are two different things, but it's progress.
Okay, so what do these plans, these solutions actually look like on the ground?
They fall into a few main buckets. First, prevention is key. Simple things. Promoting snake-safe practices, like encouraging farmers to use rubber boots, gloves, maybe a torch at night.
Basic low-cost stuff that can make a real difference.
Exactly. Using mosquito nets properly can help prevent those nighttime crate bites inside homes. And just basic awareness, teaching kids about snakes, teaching adults where risks are highest. We saw examples from West Bengal where campaigns focus simply on get to the hospital fast, don't waste time with healers.
Makes sense. Stop the bite from happening or get help immediately if it does.
Yeah.
What about the antivenom itself, making it better or more available?
That's critical. Research is needed to develop antivenoms that cover more than just the big four, like for those regional snakes. The ICMR, the Indian Council of Medical Research, is working on this. And then there's the huge logistical piece, making sure the antivenom gets to remote clinics before it expires and is stored properly.
Right, logistics can be a killer. And strengthening the healthcare side, training the doctors.
Absolutely vital. Proper training for doctors and health workers in those rural clinics is essential, so they know exactly what to do and feel confident doing it. Using things like the ICMR's treatment flowcharts can help standardize care, and making treatment free, or at least affordable, is crucial to remove that economic barrier. Plus, better rural roads and transport would make a huge difference in just getting people to help faster.
And better data helps drive all of this, presumably.
Totally. The notifiable status is the start. But then you need to ensure all cases get logged, somehow capture even those treated by healers. Using tech, like apps mapping snake hotspots, helps target resources effectively. Good data leads to good policy.
And the last piece you mentioned earlier, community engagement, working with local people.
This could be transformative. Instead of just telling people what to do, working with community leaders, even with the traditional healers themselves, that can be incredibly powerful. That example from Maharashtra's Dahanu region was amazing.
Where they trained the healers.
Yeah, the ICMR trained traditional healers to spot severe bites and, crucially, to immediately refer those patients to the hospital. They became part of the solution, leveraging the trust they already had in the community.
And the results were?
A reported 90% reduction in death rates in that specific area.
Yeah.
90%.
Wow, that's incredible. It shows that working with the reality on the ground, building trust, can have a massive impact.
It really does. It shifts the story from this is impossible to, okay, how do we replicate this? And looking globally again, you see the stark contrast. The US, Australia, they have dangerous snakes, but robust systems mean deaths are tiny, maybe a dozen a year, compared to India's 58,000.
It's worlds apart.
Completely. And hitting that WHO 2030 goal really depends heavily on India making major strides. Things like Sri Lanka doing national surveys to find risk areas, or India's own million death study that helped reveal the true numbers years ago. These build the foundation. The challenge is scaling up the solutions.
So, wrapping this deep dive, it's clear India's snakebite crisis is this enormous, often hidden tragedy. It's driven by this complex mix, the environment, how people live, the monsoon, poverty, gaps in healthcare, decades of neglect.
That sums it up well. But the crucial takeaway isn't just the scale of the problem, it's that the sources also point toward solutions. It's not hopeless.
Right. The path forward seems clear. Equip people with prevention tools and knowledge, train healthcare workers properly, make sure effective antivenom is accessible quickly, get the data right to guide action, and maybe the most vital part, genuinely engage with communities, even traditional healers, as partners.
It's a crisis where focusing on these practical steps on the ground can save tens of thousands of lives every single year.
It really makes you pause and think, doesn't it? How something like a snakebite becomes a massive killer because of these bigger systemic failings, lack of access, poverty, neglect.
And the contrast with how it's handled elsewhere is just striking.
It prompts that question about where the world puts its health priorities. And maybe, just maybe, it shows how simple, tangible actions, training a healer, providing boots, ensuring a clinic has the right antivenom and trained staff can sometimes have a more profound, life-saving impact than grand strategies that don't translate into reality for the people most at risk. This feels like a crisis where really focusing on the details, community by community, could turn this story of neglect into one of incredible progress.